Hi guys, this is Anatomy Blueprint, a student-led anatomy study guide for students who want some extra practice. This channel is led by Lena Adderzaz
and Shannon Cobb.
In this video, we will be focusing on Intro to Anatomy. Please like and subscribe and share for more.
The foundation of anatomy and physiology is the understanding of planes and directions. It sets the base and system for different movements. Superior is anything close to above. For example, the upper arm bone, the humerus, is superior to the wrist bones, the carpals. The opposite of superior is posterior. This accounts for anything below. The knee bone, patella, is posterior to the ankle bones, the tarsals. Moving on, distal and proximal are paired with the distance that a limb is from the point of attachment. Distal is defined as far away from the point of attachment of the limb of the body. Proximal is closer to the point of attachment of the limb of the body. To remember distal and proximal, think about how the muscle/bone could either be distant or in proximity to the point of attachment. Anterior is defined as the front or front of. For example, the sternum is anterior to the vertebral column. Posterior is anything behind something. An example of this could be that the vertebral column is posterior to the sternum. External is anything near the surface of the skin, while internal is anything deep within the body. The body has an invisible midline that cuts down completely from the skull all the way down to the feet. Lateral is anything that is far away from the midline, while medial is anything close to the midline.
Not only are there different directional terms, but there are also planes that dictate different areas of the body. The main planes are sagittal, transversal, and frontal. The sagittal plane can be imagined in a side-by-side perspective. Position yourself within a narrow hallway where both walls are touching your shoulders. Those walls are the planes within the sagittal plane. Any movement that occurs in that plane must be going back and forth. Any movement that is not in the back and forth motion cannot be done in the sagittal plane. The transversal plane can be imagined as a rotation of superior and inferior axis. Anything that can rotate from up to down is considered a movement within the transversal plane. Lastly, the frontal plane is a cut down the body to split into front and back parts. A good way to remember each of these planes, recognize the starting letter of each plane. Sagittal starts with S, and so does side by side. Transverse starts with T, so top to bottom. And lastly, frontal starts with the stem front, so it's similar to front and back.
With these planes, there are multiple types of movements that can be performed under their conditions. Within the sagittal plane, movements such as bicep curl, forward lunge, leg extension, elbow flexion, extension, knee flexion and extension, and hip flexion and extension can occur. These are lateral to medial motions. Within the transverse plane, movements such as trunk rotation, wood chops, and chest fly can occur. Finally, within a frontal plane, movements such as a lateral lunge or raise. The definition of rotation means moving within the confines of that axial plane. There are internal and external rotations. Axial movements can be presented in different forms. One axon movement is uniaxial, two axes movements is biaxial, and three axes movements are multi-axial. Some other movements that can be done are inversion, eversion, abduction, adduction, pronation, and supination. Starting with inversion, this means that the foot is pointing inward. Eversion means that the foot is pointing outward. Pronation is when the palms are facing downwards, and supination is when palms are facing upwards. A good way to remember supination is pretending that you're holding a soup. Adduction means bringing towards the body or the midline. Abduction means taking away from the body or the midline. And flexion means decreasing or minimizing the joint angle. An example of this would be bicep curl. Lastly, extension means increasing or maximizing the angle of the joint. And circumduction means moving the joint in a circle around its axis. For example, moving the hip joint, the ball and socket joint, in a rotating movement.
A body cavity is a fluid-filled space inside the body that holds and protects internal organs. The two largest body cavities are the ventral cavity and the dorsal cavity. Most major body cavities are subdivisions of one of these two. The ventral cavity is located anteriorly or at the front of the trunk. It contains the thoracic, the abdominal, and the pelvic cavity. The ventral cavity loss for changes in shape and size since the organs such as the lungs, stomach, and uterus expand and contract without damaging other tissue or disrupting other activities in other organs. The thoracic cavity is located in the chest and contains the heart and lungs. The abdominal cavity holds organs that are important for digestion, such as the stomach, liver, spleen, pancreas, and the large and small intestines. Finally, the pelvic cavity contains the bladder, rectum, and reproductive organs, which differ from male and females. The dorsal cavity is posterior, meaning it is at the back of the body, and houses the cranial and spinal cavities, which are essential to the body's nervous system. The cranial cavity contains the upper part of the skull and the brain. The spinal cavity, which is long and narrow, contains the spinal cord.
Moving on to the abdominal regions, it is split into 9 regions. Starting with the right hypochondriac region, this consists of the liver, gallbladder, and kidney. The right lumbar region consists of the liver, specifically the tip, small intestine, ascending colon, and right kidney. The epigastric region contains the stomach, the liver, pancreas, and right and left kidneys. The right iliac region contains small intestines, appendix, cecum, and ascending colon. The hypogastric region contains the small intestines, sigmoid colon, and the bladder. The left iliac region contains the small intestines, descending colon, and the sigmoid colon. The umbilical region contains the stomach, pancreas, small intestines, and transverse colon. The left lumbar region contains the small intestines, descending colon, and the left kidney. And lastly, the left hypochondriac region contains the stomach, liver, specifically the tip, left kidney, and the spleen. Thank you so much for watching this video. We hope it was insightful. We are always looking for improvement, so please give us feedback. Stay tuned for our next topic of discussion, homeostasis. Please like and subscribe and share for more.